If you visit the neighborhood of Bed-Stuy, Brooklyn, and New York City, you'll see a beautiful mural of an angel. The angel in the mural looks bold, glowing, and vivacious. And that angel's name is Shaija Simple, and this mural is a loving tribute to her. On July 3rd, 2020, as a result of a botched epidural, 26-year-old Shaija Simple died hours after her baby girl was born. Shaija is also a Black woman. In New York City, Black women are 12 times more likely to die from pregnancy-related causes than white women. And when looking at the bureaus, there are disparities. The Bronx had the highest percentage of pregnancy-related deaths at 31%, and Brooklyn was at 28% of pregnancy-related deaths. In comparison, Manhattan had 6% of pregnancy-related deaths in New York City. At the same time, the boroughs in New York City that had lower rates of adequate prenatal care, such as the Bronx, also have higher rates of Black residents. At the intersections of race, social economics, politics, and health lie the real-life stories of Black birthing people like Shaija, who died in New York City from pregnancy-related causes. Throughout this video, we will highlight what we found in our investigation into the driving factors behind maternal mortality of Black birthing people in New York City and go over the interdisciplinary solutions that New York City is taking to improve health outcomes for this group.
In New York City, Black birthing persons face a disproportionate rate of maternal mortality, a crisis deeply rooted in social and structural inequalities and social determinants of health. The World Health Organization defines social determinants of health as the conditions in which people are born, grow, work, live, and age. Factors like marital status, education, socioeconomic status, and access to healthcare all play a significant role in maternal outcomes. Further compounding this issue is structural racism within the healthcare system, where Black women often receive lower quality care and face biases that can lead to severe health consequences. Disparities in housing, food access, and safety also contribute to this crisis. To truly address this, we must apply a health equity lens, acknowledging that these problems are interconnected and require interdisciplinary collaboration. The solution lies in cross-sector cooperation, informed by the framework like the maternal health ecosystem, which addresses the multiple layers of maternal care and highlights how historical and contemporary systems of oppression affect Black maternal health. By addressing these structural inequalities at every level, we can work towards reducing maternal mortality for Black birthing people in New York City and create a more just healthcare system for all.
New York City aims to provide equitable and safe healthcare services to Black birthing persons. There are 3 types of services. A direct service is a healthcare service provided by the government, nonprofits, or a collective directly to the birthing person. The Northern Manhattan Perinatal Partnership is nationally recognized for their work. The partnership directly provides healthcare services such as doula care, well woman care, and providing nurse midwives if birthing persons request them, and education on pregnancy complications and advocating for oneself. The partnership aims to provide health care to Black birthing persons who experience high rates of maternal morbidity and mortality. Additionally, the Maternal Home Collaborative, provided by the Fund for Public Health New York City, located in Brooklyn, which is a new pilot program, is also going to be implemented with the aim of decreasing Black maternal morbidity and mortality rates. The program has 4 different interventions: maternal medical homes, pregnancy support professionals, maternal mental health services, and neighborhood stress-free zones that aim to provide education and support for Black birthing persons. An enabling service is a non-clinical service meant to fill the space between individuals and healthcare systems. The Maternal Child Health Community Program provides resources to birthing persons that expands beyond the hospital setting. In particular, the program provides home visits for birthing persons to aid with postpartum care, child care, and education. Finally, public health services and systems, the foundation of the maternal child health pyramid of services, are policies, institutions, and regulations aiming to provide the 10 essential public health services. The New York City Maternal Hospital Quality Improvement Network utilizes a holistic approach to address the issue of high Black maternal mortality rates. The 3 main interventions are education and healthcare settings to ensure providers understand birth outcomes are influenced not only by clinical related situations, providing education to promote anti-racist hospital systems, and to prioritize community voices.
The disproportionate rate of maternal mortality among Black women in New York City demands immediate and sustained action through a multifaceted approach. First, it is imperative to enhance access to quality health care. This includes the provision of culturally competent care that is responsive to the unique needs of Black women, particularly in addressing racial biases in medical treatment. Evidence suggests that implicit bias in healthcare settings significantly contributes to poor maternal outcomes. Thus, eliminating these biases through training and institutional reforms is essential for improving the quality of care. Second, integration of doula and midwifery services into maternal care frameworks has been shown to improve birth outcomes, particularly for women from marginalized communities. Studies indicate that continuous labor support, especially from culturally congruent doulas, can reduce rates of intervention and improve both physical and psychological outcomes for mothers. Third, comprehensive prenatal education must be prioritized. This includes ensuring that Black women have access to early, regular prenatal care, as well as educational resources that empower them to recognize warning signs, make informed decisions, and advocate for their health. Fourth, strengthening postnatal care is essential for reducing maternal mortality, as complications often arise during the postpartum period. Black women are disproportionately affected by conditions such as hypertensive disorders and infections, which, if undiagnosed or untreated, can lead to preventable deaths. Ensuring consistent postnatal monitoring, including mental health support, is necessary to improve maternal survival rates. While New York City has made significant strides in maternal health data collection and surveillance, challenges remain. Investments in data integration, expanding data on maternal morbidity, and strengthening accountability mechanisms are critical for improving maternal health outcomes and reducing racial disparities. Continued commitment to robust data-driven policies and community involvement will be essential in addressing these long-standing inequalities. To reduce Black maternal mortality in New York City, strengthening community support is crucial. Expanding peer support networks, providing health education, and increasing access to culturally competent care can empower Black women to advocate for their health. Additionally, programs like community health workers, improved mental health services, along with supporting Black-led organizations and advocating for policy changes are key to addressing disparities and improving maternal health outcomes.
Thank you for taking the time to learn about the crisis New York City is facing with maternal mortality of Black birthing persons. We believe that by continuing to fund and build up services in low-income and diverse neighborhoods, prioritizing education, and advocating for policies that aim to reduce health disparities, we can reduce maternal mortality of Black birthing persons in New York City. This work is so important to make sure we don't have another preventable death like that of Shaeja Semple.